Assalamu alaikum everyone. My name is Mohammad Rehan and I have done my generic BSN and the Masters in Biostats and Epidemiology. Today we are going to discuss Introduction to Nursing Research. It's the first chapter of Introduction to Nursing Research. The objectives of today's lecture will be define nursing research, describe ways of knowing in nursing, tradition, authority, borrowing, trial and error, intuition and research, explain evidence-based practice through research. So we are going to start with the definition of research. Research is a systematic inquiry that use disciplined methods to answer questions or solve problems. Ultimate goal of research is to develop, refine, and expand knowledge. Uh, Previously, nurses are not actively engaged in research, but in today's era, nursing are doing a huge amount of research. Nurses are increasingly engaged in disciplined studies that benefit nursing and its client, that contribute to improvement in the entire healthcare system. So now the question arises in our mind according to research is how do we know what we know as nurse? So ways of knowing are various methods used to acquire new knowledge in nursing. For example, you might say that you know your friend John know that Earth rotates around the sun, know how to give an injection, know pharmacology. These all are the examples of knowing, being familiar with a person, comprehending the fact, acquiring a psychomotor skill, and mastering a subject. These are the various ways of knowing. These are some other knows, other ways of knowledge gaining. So there are a variety of sources such as tradition, authority, trial and error, personal experience, logical reasoning, and use of scientific method. So tradition is arise from the cultural aspect. Authority is the one master person who guide us. Trial and error, we do something and get knowledge from it. Personal experience, when we spend a lot of amount of time in one area, so we get personal experience. Logical reasoning, there are two types of logical reasoning: inductive reasoning and deductive reasoning. This is also a ways of knowing. And the use of scientific method is a research. And the highest, if we ask which way have a highest priority in knowing, so scientific method or research have the highest value of knowing. The use of a scientific method is of primary concern to nursing as a science. As consumer of research, nurses need to know how information is gathered and organized in a research or scientific context, because research creates a evidence-based practice. The use of the best scientific evidence integrated with clinical experience and incorporated patient values and preferences in the practice of professional nursing care. So using research in evidence-based practice, research is a key element in evidence-based practice. Scientific rigorous peer review studies are the foundation of the evidence for professional nursing practice. Selecting, reviewing, and incorporating research finding into practice are the heart of professional nursing care delivery. Although it will seem obvious that applied research in the most helpful for evidence-based practice, basic research may also be used. Both quantitative and qualitative research are useful in evidence-based practice. Also, it is clear that randomization controlled trial, both singularly or aggregate, provide the strongest evidence-based practice. These are the references of today's lecture. So we have covered today's first lecture. In next session, we will cover the unit 2, ethics in research. Thank you so much.